As coronavirus continues to spread, families with elderly loved ones who test positive are facing hard decisions. Thanks for joining us. I'm Greg Glover.
And I'm Latrice Curry. Channel 3's Travis Cummings spoke with a family forced to make the decision and choose between bringing a sick family member home or returning that patient to a nursing home. A tough decision, Travis.
Yeah, Latrice, you know it is. The hospital was following CDC guidelines, but one woman says her mom got sick with COVID-19 and she found herself having to choose between possibly infecting the rest of her family or other residents of her mother's nursing home. It's a scenario she wants other families to be prepared for.
A nightmare. Nightmare.
Chris Kransky has been taking care of her 79-year-old mother, Elizabeth Harris, since the pandemic began.
Over the course of the last 3 months has gone from being just oxygen dependent to now she's dependent on a BiPAP, and we can step up to a trilogy, which is literally one step below a ventilator.
Her mom has chronic obstructive pulmonary disease, which makes it hard to breathe. After a stay at Memorial Hospital, she was admitted to NHC Healthcare about 3 months ago, but medical issues kept her returning to the hospital.
The most she's ever made it there was 10 days, then 7 days, and this last time she didn't make it 48 hours.
After 9 negative COVID-19 tests, Harris tested positive while in the hospital.
I was really concerned as to where she could have been exposed because she's been nowhere but a facility or the hospital.
Kransky says she was told her mother would have to leave the hospital to quarantine for 10 days, leaving her to decide if she would take her mom home to expose her family or return her to the nursing home, risking exposure to other residents. According to the state, as of November 9th, NHC reported 18 active cases of COVID-19 among 165 residents.
I have a problem with that. So you don't know that your family members are going in somewhere where there's active COVID patients?
Kransky says it's a tough decision she wasn't prepared to face, but it's one she wants other families to be ready for.
But I will not send her into a nursing home in Hamilton County and let any other family go through what we're going through. I won't do it.
Now, late this afternoon, Kransky called me back and says Memorial is going to allow her mom to finish out her quarantine at the hospital, and that quarantine ends on Saturday. Now, according to the CDC, COVID-19 patients can be discharged when it's clinically safe for the patient to do so. A patient can still be infectious when released, but is asked to isolate. A spokesperson for Memorial confirmed that the hospital follows the guidance from the CDC. We reached out to NHC to learn more about how they handle COVID-19 discharges that require residents to return to their property. When we hear back, we'll share more on their policy. In the studio, Travis Cummings, Channel 3 Eyewitness News.